Hello everyone, welcome to today's presentation on how we can build organizational resilience and flatten the mental health curve. My name is Saleema Dhalla, and I'm the Senior Director of Strategic Engagement and Development at SafeCare BC. Presenting with me is Jennifer Lyle, the CEO of SafeCare BC. SafeCare BC is the Health and Safety Association for long-term care and home and community living. The work we do is aimed towards those who are working in the continuing care sector to create safer, healthier workplaces by fostering a culture of safety through evidence-based education, leadership, and collaboration. Today's presentation will aim to meet the following learning objectives. Understand the current state of research into the prevalence and cause of mental health disorder within the continuing care sector. Apply lessons learned in other disasters to the continuing care sector to understand what drives resiliency, and identify practical strategies that can be implemented to prevent and address mental health distress among staff. We hope you enjoy this video presentation and look forward to our live discussion later this week. As we can all appreciate, the past year has taken a tremendous toll on the sector and those working and living in it. We're seeing a considerable amount of data to show that mental health is declining, and we're hearing that our sector needs support to address the mental decline that we're experiencing. The trend line for mental health is going up, and we'd like to talk about the data that's driving these numbers, and then look at how we can learn from previous disasters and implement practical strategies to flatten this curve. Let's start with defining psychological health and safety, as this is a term that we hear often to explain how mental health affects the workplace. According to the Canadian Standards Association, psychological health and safety in the workplace is a workplace that promotes workers' psychological well-being and actively works to prevent harm to workers' psychological health in negligent, reckless, or intentional ways. The World Health Organization notes that in the positive sense, mental health is the foundation of well-being and effective functioning for an individual and for a community. We know that mental health occurs along a continuum, with thriving and positive mental health at one end and serious mental illness or addictions at the other. In between, however, there are many shades of substance abuse, anxiety, depression, and other conditions that vary in intensity and impact. Looking at the data broadly across all workplaces, we know that work can help or hurt mental health. The Canadian Mental Health Association reports that 47% of Canadian employees say that work is the most stressful part of their day. 90% of employees agree that a mentally healthy workplace is a productive one. 2/3 of employees would not talk to their employer if they had a mental health problem. Next, let's talk about how this is affecting our sector by looking at sector-specific data. This SafeCare BC 2020 member survey found that 39% of survey respondents indicated that mental health and stress was a top safety concern at their workplace. And over 76% indicated feeling very or somewhat anxious about COVID-19. The percentage of those feeling very anxious about COVID-19 was the highest amongst the frontline workers and those working in long-term care. A crowdsourcing initiative that was done by Statistics Canada in collaboration with Health Canada and the Canadian Institute for Health Information and the Public Health Agency of Canada found that 7 in 10 healthcare workers reported worsening mental health during the pandemic. The COVID-19 pandemic has highlighted that healthcare workers may be at increased risk of mental health impacts because of increased exposure and demanding work conditions. 8 months into the global pandemic, 1/3 of participating healthcare workers reported fair or poor mental health. 1/3 reported good mental health, and 1/3 reported very good or excellent mental health. Most participating healthcare workers reported that their mental health was somewhat worse now or much worse now compared to before March of 2020. Some healthcare workers are at a disproportionate risk of infection because of the nature of their job. Among crowdsourcing participants, 40% reported working in direct contact with confirmed or suspected cases of COVID-19. Most of these were workers, followed by other health professionals and personal support workers or care aides. We all know someone who falls within this group. One of the findings of this report indicated that access to appropriate personal protective equipment was associated with better self-reported mental health and lower stress levels. Specifically, respondents indicated that their mental health worsened if there were restrictions associated with PPE use, such as inventory control measures, extending the use beyond normal practice, or requiring permission to use PPE. Healthcare workers citing no restrictions or conditions on the supply of PPE reported better mental health and stress outcomes than participants who experienced restrictions or conditions. Knowing that this was a challenge in BC for many operators, we recognize that some of this may be difficult to process for our audience, and we encourage any of you who may feel triggered from this to seek the support that you need to cope. Next, let's look at the impact this has had on people working in the sector. Over the past year, there have been many stressors for those working in the sector due to the pandemic. Some of the stressors include shortage of PPE and lack of clarity on provisions for its use, scrutiny from the media, isolation from family and other supports, fears of transmitting the virus to loved ones, increased workload, depleted workforce due to illness and isolation of staff, and lack of effective treatment for unwell residents and clients. The impact of these stressors may present themselves in the workplace as absenteeism, disability claims, sick leave, and workers' compensation premiums, resulting in higher costs. All of these have a negative impact on the organization's operations and culture. SafeCare BC interviewed individuals working in the sector to learn more about their experience during the pandemic and how it's impacted their mental health. Langley Lodge was one of the hardest hit long-term care homes in BC, with a total of 26 deaths among residents. The stress and loss created emotional scars among the staff. Lisa Sams Maxwell, the Director of Care at Langley Lodge, shares the impact of the pandemic on care staff.
The accountability and the responsibility during COVID was extreme. I can honestly say I've never worked through anything as stressful, and it took such a toll on myself and other people. We did do sessions here and that, but even that doesn't go to the extent that people need. I have found myself even today, when I talk to people about our outbreak and it's like it starts an emotional and physical reaction in my body that I really feel that many of us have some level of post-traumatic stress disorder, and that we're probably going to have to deal with things further down the road.
As COVID-19 swept through the dementia ward of Langley Lodge throughout May of 2020, staff tried to comfort dying residents and families who couldn't be with their loved ones. Marilyn Meyer, a care aide at Langley Lodge, speaks to her experience caring for residents in their final days.
These people here are my heart. They're like my family. I looked after them like I looked after my mother and my grandparents. So they were very close to me. And working through COVID was a whole different situation, because a lot of these people were very weak and needed our time. It was hard. It's emotional too right now. Thinking of one of the residents that we had, his family member was outside, so I wheeled his bed the day before he passed away to the window so his daughter can see him.
The result of these types of experiences has led to many people sharing that their staff feel burnt out. The data indicates that burnout has been well documented and is at record highs. What's noteworthy is that the same issues that drive burnout also diminish joy for healthcare workers in the workforce. Healthcare leaders need to understand what factors are diminishing joy in work, nurture their workforce, and address the issues that drive burnout and remove joy in work. The most joyful, productive, and engaged staff feel both physically and psychologically safe, appreciate the meaning and purpose of their work, have some choice and control over their time, experience camaraderie with others at work, and perceive their work to be fair and equitable. Moving to the next part of today's presentation, we'd like to discuss how we can learn from past disasters to strengthen our recovery response.
So now that we have a sense of what the current mental health landscape looks like from a more broad picture, what can we learn about past disasters or past significant events in terms of how that impacts our mental health? We've all seen a lot of curves these days, but I'm going to talk to you about a new one today, and that's the mental health curve of a significant disaster or crisis. Now, this curve was taken from the training manual for mental health and human service workers in major disasters, as developed by the U.S. Department of Health and Human Services. And what it does is it lays out the mental health experiences of a community as a community experiences a significant negative event, a disaster, or something to that effect. What you can see through this is that the first phase is really that pre-disaster phase, a sense of anticipation that something might be happening. An example for us in this current context would be when that first cluster of cases was reported in Wuhan, China. And you can see how that starts to trend downward in terms of emotional lows. And then there's a pivotal moment at which point the threat becomes real and immediate. And the parallel to our current experience right now would be, for example, the first outbreak in Canada, Lynn Valley Care Center. And you can see again how our collective mental health trends downward. After that is when we start to move into the heroic phase. So this is the action phase. We're responding to the crisis in front of us. It's characterized by a lot of, community cohesion, the sense of us all springing into action, working together. An example of this, again, in the current context would be the 7 o'clock cheer that we saw during the first wave of the pandemic. And then we start to move into the disillusionment phase. And this is where we start to see some really significant emotional lows as experienced in the community. Now, for us through COVID-19, this is where our experience departs from the typical disaster. And that's because typical disasters are usually fairly time limited. For example, the earthquake in Christchurch, New Zealand, 9/11, Hurricane Katrina. For us, the pandemic has been much, much longer than any of these events. And what that means is that this phase of disillusionment has also been far longer. We ran out of adrenaline a long time ago, and now we're just tired. We're burnt out, we feel forgotten, and we feel like there's no end in sight, and we're questioning why we're even still here. And this is where people are often at their most vulnerable. After the disillusionment phase comes reconstruction, and I would argue that in our current context, we're right at the junction between disillusionment and reconstruction. And really what this is we start to get through that recovery phase. Now, reconstruction is not smooth. It's a bumpy projection with ups and downs, and you can have trigger events that can trigger low mood or certain challenges with regards to mental health. In our current context, for example, it might be the date of your care home outbreak. It might be the date that you had your first COVID test. It might be an event that reminds you of something. So for example, when you come into your first flu case this coming respiratory season, those events can be triggering, and it's important to be particularly sensitive and aware of these things, because we know that people who are otherwise doing okay or who seem to be doing fine can suddenly be not okay quite quickly. And it's important to have the supports in place to help people through those patches. But overall, as we move through the reconstruction phase, we start to collectively work through our grief, and we realize a new equilibrium and reach that phase of recovery. So that's what the general landscape looks like from a community-based perspective in terms of what mental health looks like throughout the course of a disaster, both before, during, and after. And for the most part, that rings true for continuing care workers. But there are some important differences and some unique characteristics about the healthcare workforce and arguably the continuing care workforce that make our experiences with regards to mental health in response to a crisis unique. Now, I'll give you an example. So during the SARS epidemic, people looked at the mental health outcomes of healthcare workers versus the general public. And what they found is that even healthcare workers who had no contact with SARS patients reported poorer mental health outcomes than the general public during the same time period. Now, what's the reason behind this? Well, because in addition to being part of the general community and experiencing what the community experiences as you move through a crisis, healthcare workers are often at the front lines of a disaster or a crisis response. And this means that they are a high-risk group when it comes to negative mental health outcomes. You can see the parallel between that and our current experience right now, where arguably the continuing care workforce has been on the front lines of the COVID-19 pandemic. It also has important ramifications for after the fact, once the danger is over. And we can give a great example from BC here. In 2017, we had an awful forest fire season, record-breaking forest fire season. A lot of continuing care workers or healthcare workers in the community were not only impacted personally because perhaps their community was under evacuation orders or alerts, but they were also impacted in their work. Maybe they were involved in an evacuation effort. Maybe they were involved directly in humanitarian relief efforts for those who've been displaced. But what ended up happening is in 2018, a year after the fact, people who, had otherwise been fine, they showed no outward signs or symptoms of distress, were suddenly calling in sick or reporting significant levels of anxiety because come 2018, what happened in the summer again, we had another forest fire season. So those people who were on the front lines of the response work in 2017 were all of a sudden being triggered by seeing smoky skies and the sky turning orange again. So that's one of the reasons why when we look at healthcare workers, we treat them as a high-risk group when it comes to mental health. So now that we understand a little bit about the experience in past crises, what worked in terms of mental health supports for people who were in those situations? Really, it comes down to 4 key takeaways. For one, we need to look at democratizing mental health supports, and I'll give you an example. Mental health support programs don't always need to be clinician-led. Peer-to-peer supports can be very effective. After the Lac-Mégantic rail disaster, health leaders created opportunities using outreach workers in the community to bring members of the community together to help them make sense for what had happened. And one initiative in particular was to invite people to take pictures of whatever made them feel proud about their community. And then people then came together with their pictures and they shared the story behind their picture. And this initiative helped people process the tragedy and share in a non-clinical setting their experiences in what was effectively a peer-to-peer support forum grounded in the community itself. And the reason why that's important ties right into point number 2, which is we have to be aware of stigma. Stigma is a powerful deterrent to prevent people from accessing support when they need it. And we also know on the flip side that sometimes the most successful mental health support programs are ones that don't look like mental health supports. An example is an initiative that came out of 9/11 support programs that actually blended support groups which were focused on supporting people with their physical symptoms. So for example, first responders dealing with respiratory symptoms because of the dust that they'd inhaled at the recovery sites, with mental health supports. So these support groups were not dedicated mental health support groups. They were about physical symptoms, but because they wove mental health support in there, they were actually able to reach a group of people who otherwise would have likely not reached out for help with regards to the mental health symptoms that they were experiencing as well. And that piece around stigma also ties back to the fact that leaders set the tone. We know that organizations whose leadership are supportive and speak openly about mental health, their employees are more likely to seek out help earlier. And the reason why this is important, I know we talked about statistics earlier, but even before the pandemic, it was estimated that about 500,000 Canadians miss work each week due to a mental health issue. And in an unrelated survey, 95% of employees who had taken time off due to stress named another reason, for example, an upset stomach or a headache, as to the reason why they were taking time off. They never told their employer that they were taking time off because of a mental health issue. And not to put too fine a point on it, but if this wasn't enough of a reason, a recent YouGov survey of UK healthcare workers indicated that 16% of those who worked in care homes felt like their mental health would never recover. So as leaders, you play a powerful role in either reinforcing stigma and deterring people from seeking help or encouraging them to seek it. And then the last bit really factors back to this concept of collaborative efforts. Community-based efforts are more effective than top-down ones. We see in previous initiatives that have been done in the past that by working with the natural opinion leaders in your target audience, whether it's your community, whether it's within your organization, you can both better understand the issues that people face, and by partnering with those key opinion leaders, you have greater legitimacy in determining the priorities for recovery, and ultimately you will be more successful in providing support that's actually more likely to make a difference because you have insight from those key opinion leaders within your intended audience. So now that we have a broad sense in terms of what we've learned in previous disasters, there's a couple key takeaways that come from it. We know that the mental health impacts of the disaster are something that are quite far-reaching and will impact everyone, but they'll impact people at different points and in different ways. And that's largely determined by both what's happening around that person at any given point in time, but also the nature of the supports that they have access to. We also know that mental health supports don't have to look like the traditional EFAP model. They don't have to be clinician-led. They don't have to be counseling-based. And sometimes the most successful mental health initiatives are ones that don't look like mental health initiatives at all. And then finally, we know that with this information, we have tools and ideas that we can take into the next wave as we deal with our own mental health pandemic. The question, of course, now that we're going to deal with next is what do we do with this information?
Looking at translating this knowledge, we'd like to focus the next part of the presentation on sharing actionable ideas that leaders can use in their coronavirus response now, which can build the longer-term foundation to sustain joy in work for the healthcare workforce. Our first strategy is a conversation. Yes, that's right. We believe that looking at something as simple as the way you talk to your colleagues and staff can have a huge impact on the psychological health and safety, and in turn, the mental health of your organization. An example of an effective conversation starter is, what concerns do you have for yourself or the team? Then you want to confirm that you've heard what they've said by saying something like, this is what I hear you say. Do I have this right? Next, you want to work together to address the concern that they've shared. Given the context of the COVID-19 pandemic, we think you can take conversations even further by acknowledging the demands that people have on them, both at work and in their personal life. Here's an example of what a conversation may look like as you acknowledge what demands people may have happening in their life. Asking, how are you? And then listening. And asking, what do you need right now? We know that it can be challenging given all of the things that you have happening in your day, but it's important to try and stay positive and be patient so that the people on your team feel supported and heard. Effective and meaningful conversations also help to remove stigma, which, if you remember from the previous section on disasters, is a way to rebuild the organization. One organization has adopted a program called Not Myself Today, which encourages people to talk about their moods to help understand them. This workplace mental health initiative builds organizations and helps reduce stigma as well as fosters safe and supportive cultures. The program offers staff buttons to choose from that they can wear to describe how they're feeling on that particular day. Based on this, colleagues are encouraged to learn about how they're feeling as a way of taking care of their own mental health. Some of the moods described by the buttons include anxious, inspired, hopeless, chill, indecisive, giddy, sad, and deflated. By letting people acknowledge their own moods and share it with others, this initiative reduces the stigma around these feelings. The next practical strategy that we'll look at is celebrate and acknowledge. As we learned from the section on previous disasters, we know that trigger events may be met with joy and new reasons to celebrate even after a tragedy. We also learned that leaders set the tone and collaborative efforts are better than individual efforts. For this reason, we suggest building in an acknowledgement event into your recovery planning to mark what was overcome by the workplace during the pandemic. This can be something as simple as a date that's marked in the calendar to remember the residents that were lost and giving staff a chance to remember and reflect on what they experienced. Another element of celebrating and acknowledging is giving people the opportunity to storytell. You may want to plan a special event that gives staff a chance to remember and talk about what they experienced and how they remember the past year being for them. It's important to celebrate what was achieved. This can be as simple as recognizing what the team has overcome over the past year. Noting that while it was a difficult year, the team came together and progressed, and likely they learned along the way. One organization has shared that they're in the process of putting together a pandemic recovery plan. The goal of the recovery plan is to promote wellness amongst the organization and recognize what's been achieved, ensure that there's appropriate time and space to grieve the loss that's taken place, and strengthen practices for the future. If you're considering developing a plan for your organization, make it a collaborative one so that the staff feel connected to the overarching goals and the purpose behind the efforts. The last strategy that we want to share is about reflection. For this one, I'd like to walk you through an exercise. Choose one of the following questions that you see on your screen. What's one good thing that's happened at work recently? What are you most proud of? What's one positive change that you have made in your life as a result of the pandemic? We're going to pause for a minute while you think about the question and answer it on your own. Okay, that was 1 minute. How did that feel? Did the question elicit a positive response from you? Were you able to stop in the moment and think about something good that has happened from everything in the past year? We recommend you giving this a try at your workplace. Ask your colleagues and staff questions about something that will elicit a positive response. If you can, try and do this on a daily basis at your workplace until it becomes something you no longer think about. As many of you represent part of your leadership team, we'd also suggest you teach your colleagues to try the same strategies. This will help embed the practice into your organizational culture. If you're wondering about how these strategies might link back to the Psychological Health and Safety Standard and the 13 workplace factors that make up the standard, we believe that these strategies can help your organization meet the goals behind several of these factors. For example, implementing effective conversations in your workplace improves psychological support and organizational culture. It also promotes civility and respect and increases engagement among staff. Celebrating and acknowledging the pandemic and creating dedicated space for this is associated with recognition and reward, and developing a plan for recovery with the involvement of the team relates to involvement and influence. Here you can see that simple strategies can help address a very complex topic in small and meaningful ways. Thank you for taking the time to learn about how you can help flatten the mental health curve. We look forward to a live discussion on this topic on June 1st. Also, as mentioned at the start of this presentation, it's been an immensely difficult year. If any of the material presented today was difficult to watch or listen to, we encourage you to reach out for help at either Safe Care BC, Care for Caregivers, or with your healthcare professional. For those of you that may be unaware, Care for Caregivers was started last year as a joint initiative between Safe Care BC and the Canadian Mental Health Association. The purpose of the program is to provide up-to-date, credible information, free workshops to learn about resiliency, and quick daily coping tips. This site provides a diverse collection of quick and easy resources to support your mental health. We also offer a free call line called Care to Speak. It's a peer support service that provides emotional and psychological help to healthcare workers. If you need someone to talk to about anything, we're here. Give us a call or chat with us online. It's free and it's confidential. Thank you.